Dr. Arafat?
Yes, thank you very much. I'm happy to start with the presentation. I will share my screen and I will try to be as clear as possible. I hope you hear me well. Please let me know if you can see my screen.
Yes, we can see it.
Yeah, just 1 second, please. I have to take the presentation to the beginning. Okay. So what I'm going to try to do is to speak more about what we have been doing in Romania in the management of the COVID situation. And I would say that when we ask about risk management and emergency management, I think that the emergency management is part of the risk management. The risk management is an overarching issue which looks at all the other aspects like prevention, preparedness, identification of the risks, all these issues. And then when the emergency happens and the risk starts producing an impact, then we are going to the emergency management of that issue. I think that the pandemic have shown us a lot of things, and one of the things that I want to underline is that looking behind at 2019, even before 2018, I found at least 2 situations where I was speaking about the pandemic risk. One was on 2018 during a major earthquake disaster course that we exercised, a MODEX exercise in Romania, where in an interview, I didn't even remember it until I saw it on the site of the EU, an interview I was talking about the pandemic risk and the impact of a pandemic, what it may be. And then in 2019, when Romania had the presidency at the European level, we had an exercise, a tabletop exercise run by us in Brussels, together with the hybrid center of excellence, which is an Euro-Atlantic center, which is based in Helsinki. And our conclusion was very clear in February 2019. Europe is not prepared to face the pandemic. And at the beginning of the pandemic, this thing was very obvious. We were not prepared to face the pandemic. We built up our preparedness during the emergency and not before the emergency. So if we look at what happened very shortly before I go to how we managed this situation in Romania, we all know what happened. We all know that the WHO declared the global medical emergency on the 31st of January 2020, and the pandemic on the 11th of March of 2020. And in Romania, we started working and preparing before the WHO declared a pandemic. The first discussions we had when we saw what was happening in China and when we drew the alarm, let us say, is that we had a committee meeting, which is a group, which we call it the Highly Contagious Diseases Working Group, which is under the National Committee for Emergency Situations headed by the Prime Minister. We called in the group, which has several specialists in it, and we started sounding the alarm that this is something to take very seriously and we need to prepare. Stockpiling, bringing equipment, preparing ourselves for mass ventilations and so on were on our table, and they were all discussed even during the exercise that we had when we were in Brussels. Diana, sun eu înapoi că am intrat într-un curs și îți dau eu telefon când termin. Ok, bine, mersi. Sorry, so the preparedness started, but of course we were in a race with the pandemic itself. We woke up in a situation where we had no access to protective equipment. It was very hard to find protective equipment. The markets went crazy. We had prices going 10, 15, 20 times high. We had no reliable partners to work with from the point of view of purchasing equipment. We had emergency procedure instituted so that we can purchase equipment directly. Today, we were discussing with a company which was saying, okay, we will be selling so many ventilators. The second day, they were calling us, forget what we told you yesterday. We cancel the agreement because we're going to sell them somewhere else. And this is what was happening with us. Another issue which happened in the market is that most of the resources were coming from a certain area, which is Asia and mainly China. And this created for us a huge dependency, which was for the whole world. And there was an issue of transport of equipment, finding transporters. It was very hard to find airplanes to transport the materials. So Romania called on NATO base in Hungary to use our hours in the NATO base. Romania has hours there to send the airplanes to bring equipment from Asia and mainly from South Korea, where we bought most of our protective equipment from there. But still, it was very hard to deal with the status that we found ourselves in, which showed us clearly that we missed the opportunity to prepare ourselves, though we knew that this risk earlier or later it was coming and that it will take place. So what happened as a coordination modality, I will go further very shortly. Romania had the first lockdown on the 16th of March after the first cases appeared. We declared a state of emergency, which is a very high state, which is declared by the president, and it has a particular way of management, but this lasted for two months, and then we dropped down to a state of alert, which we are in even now, and we started working under a state of alert since the month of May. Some other issues which happened with us during the evolution. The first month was very easy to work with because there was still no fake news coming out, very little. It was still people were worried about the virus. We didn't have organized groups to talk against the pandemic and that they don't recognize the pandemic. And slowly these groups start appearing besides the fights between politicians. We were on the verge of elections. So our politicians started fighting, the opposition with the government. And this all started having an impact and dropping the confidence of the population. The population lost slowly the confidence through the fact that we were coming out and saying things, and then some politicians were going and attacking what was said. If something was done, somebody was coming out, this is not the right way, you should have done it this way. And this all created a huge pressure on us, which were managing the pandemic, besides the pandemic itself. So I would say that we were characterized by lacking of wisdom amongst the people who had to be the most wise during a disaster. And some of them behaved like children instead of behaving like wise adults when a country is facing a disaster. And we've seen these models not only in Romania, in many other countries, where wisdom was the last thing to call upon and where the behavior was very weird. And it was clear that it was working for political benefits or personal benefits and so on, at least partially. So the first measures we took is we started quarantining people coming. This is one more thing to add here. Romania had a very particular case. Romania has millions of people outside in countries like Italy and Spain and the UK. And what happened is that a major spread of the virus happened exactly in these countries, Italy, Spain, and later the UK. And we were on the verge of having Easter celebrations, and all people in these countries, all Romanians, were planning to come to Romania to visit their families. So the president of Romania, who took a very important role in the management of the situation, and us, we started sending the messages, please don't come to Romania during this Easter. Stay where you are. This created a lot of problems. Some people listened to us, some people didn't listen to us. So we instituted quarantines, which were, when people came in Romania, they had to stay somewhere for 14 days. before going and meeting their family. This also created a lot of reaction by the people. But in my opinion, this helped us control the spread of the virus very seriously in the first months in Romania. Romania didn't have a huge impact in the first months because, in my opinion, one of the reasons is that we controlled the spread of the virus. And one other thing which created a lot of discussions was the obligation to admit to hospital asymptomatic positive people. And at the beginning, we didn't have many cases. So asymptomatic positive people were admitted for 10 days or 14 days. This created a huge discussion again on human rights and on the fact that this is not correct because we are stopping people from having their rights, from being free and being able to do whatever they want because they were asymptomatic. And it took a lot to convince and to explain. Being asymptomatic, it doesn't mean you don't transmit the disease. And it took a lot of time, but at a certain moment, we had to leave people go and do whatever they want because the politicians succeeded to cancel all the legislation we had for about 3 weeks in order to rewrite it. And those 3 weeks, we had people who were infected going down in the streets, doing whatever they want. If they wanted to stay home, they stayed home. If they didn't want, we could do nothing. And we can see that that decision, which canceled our legislation of our constitutional court based on the political complaints that were filed there, and the increase in the second wave in Romania, they went together. We could see how things started increasing when people didn't quarantine, didn't isolate themselves from the others. So these were very important issues to mention about the situation we faced. So these are the numbers which I don't think are extremely important. I will go further on how we managed the situation. Romania has, again, a peculiar system. We have a national emergency system. And the national emergency system, it means that we don't have decentralized emergency response. Yes, every county has its own service, its own inspectorate for emergency situations, its own health department, and so on. But at the end, they all are answering towards the national level. They are not independent in their decisions. And I think this was not a bad thing to have for such a disaster. This allowed us to manage the disaster much better. So how are we organized? We have the National Committee for Emergency Situations. This is headed by the Prime Minister. It has 3 vice presidents. One is the Minister of Interior. One is the Minister of Public Works and Administration, who's responsible for the local authorities and the relation with the local authorities. And one is the head of the Department for Emergency Situations, which is myself, which I'm Secretary of State in the Ministry of Interior, but still in that committee, Vice President of the committee. Then we have what we call the Action Commander. What does this mean? Whenever we have a disaster which exceeds one county, we can nominate an Action Commander to coordinate the whole thing for that disaster. Even if it is in one county, if it is something very serious, we can nominate a person. By law, the Action Commander is the head of the Department for Emergency Situations, or a person nominated by him for a certain field or a certain emergency. So here, the Action Commander, which would coordinate the whole activities operationally, would be the head of the Department for Emergency Situations, and this is what happened. Then we have the National Center for Coordination and Management of the intervention. This is under the General Inspectorate for Emergency Situations, which is a military structure. This is the fire and rescue, or the civil protection of Romania. This is a military structure since 1835. By tradition, it's a very old tradition in Romania. And our rules is that when we have a disaster, we activate that center. That center was never activated for a real emergency until the pandemic. its main reason of creation was if we will face a major earthquake. We tested it during the MODEX exercise for 5 days and 4 nights in 2018. So we were really used to on how we are going to make it work, but it was the first time to work really. So that center had correspondent centers in each county. There are 40 counties plus Bucharest. Each county had a similar center at a lower level in that county. So at the national center, we had all ministries and agencies involved, Ministry of Health, Ministry of Interior, we had the police, we had the civil protection, we had the gendarmerie, we had the army, the Air Force, everyone was represented there. And then on the local level, we had the correspondent structures, maybe not all of them, present in their centers. And this is how we managed through those centers, every county. So the information was coming through the county centers to the national center. From the national center, the national committee was informed, and the prime minister and the ministers were informed. And from the national center, general rules, regulations, and so on were going down to the level of the county centers and so on. So if we look here at how that center was active, how it worked, we have the National Committee for Emergency Situations under the Prime Minister, the Action Commander, and we have a military chief of the Center for Coordination from the Fire Service, who coordinates all the activities in the center, and he answers to the Action Commander. We have the Secretariat, and then we have the levels which we have in the national center, the operational management, the records, the public order, that's police and so on, the juridical support, and the communications and IT support. And then we can see different entities which were working in that center, including, you see here, beds and ventilators, isolated and quarantined persons, vaccination activities, and so on, which have a different committee dealing with them. And here are the main structures which were in the center permanently: Ministry of Health, the Public Health National Institute, the representatives of the emergency medical services were all there. Always we had a team which was a medical management team, which was responsible for managing the situation, and especially the transfer of patients. When hospitals had patients that they couldn't transfer, they were calling on the center, on the medical management group, and there we were trying to find places and find the best way of transfer, whether it is a helicopter or an aeroplane or a military aeroplane or by ground ambulance. So the medical management, as I said, was one of the most important parts, but it was not sufficient. We had all the other sides, especially the logistical support and the stock management, because we had our stockpiles, which we dealt with, and that center was the one dealing with this. So when hospitals couldn't find protective equipment, they were requesting from our strategic stockpiles, we need protective equipment, we need so much. We would analyze it and we would send that material to them. So we were trying to avoid that the hospital remains without protective materials, even ventilators, injection pumps, high flow oxygen therapy. All these we gathered in our national strategic stockpiles, and we distributed in the country based on the needs in the country. So, as I said, it started operating on the 18th of March 2020, that center. Now it's still operational. In the last 2 months, we went on a lower level, but now we decided that in September, we are going to reactivate nearly the full level of the center. We can operate it on different levels. You can see here some images from the center, which can show how it worked. So continuous information flow between components, coordination and provision of specialized technical assistance, monitoring the resources needed to carry out the missions for the COVID management, data analysis, which every day we had data analysis and the video conference with the whole country discussing about the data evolution. Now we moved it into 1 time per week. next 2 weeks, I think we will come back to 1 time per day or at least 3 times per week to have such an analysis. The medical management dealt with the inter-hospital transfers. Very important point, the detachment of medical staff. This came to us by law. We insisted on it because doctors were not always very happy to move from where they were to other hospitals to help. So we created by law a mechanism where we can do it by order. So the commander of the action can issue an order valid for 1 month to move a doctor or a nurse from one hospital to another hospital. And we issued over 12,000 orders moving personnel in the country between health facilities, because we had health facilities where the doctors and nurses were getting sick. We needed to replace them so that the facility can care for patients later. So we moved from facilities which had more doctors to those which were lacking doctors and nurses. Then we mobilized medical residents which were under training, and we used them for the training. Then we moved students, and we recruited 2,000 students, which we used them as volunteers, and by law, we allowed them to work as nurses. So they were by law working as nurses. They were 5th and 6th year medical students. And all their movements were done based on orders issued by the action commander. So you can imagine the work which was run in this center and how intense it was. I can tell you that some nights they were coming at 2 o'clock in the morning to sign papers. They were coming at 1 o'clock in the morning to sign papers because these needed to work indifferently what time of the day or of the night it is. Intensive care units, we had 3,317 inter-hospital transfers managed by our center, by the medical team during the first, second, and third wave. That is except for those which were managed directly between hospitals. So these are the ones which were difficult to find places for them, and we managed them at the highest level. And 10,104 medical staff was detached in different areas in the country. So this can show you the level of the work which happened. So here, I will show you one thing. You are watching an intensive care unit. This is one of the solutions we have. What you are watching is a truck. This is a mobile intensive care unit attached to a hospital. We bought 5 of these at the beginning of the pandemic using money from donations. We brought them within the next 2 months. They treated hundreds of patients which had no places inside the hospital. If I wouldn't tell you this is a truck, maybe you wouldn't imagine this is a truck. So these were solutions that we adapted for our management of the pandemic. Then the transfer of the patients. And here we used our helicopters. We have the EC-135 or the Airbus 135 helicopters for medical response, but for the COVID patients, we used large helicopters, which allowed us to contain or to protect the team better than the small helicopters, but we still used also the small helicopters. Those ambulances are very special ambulances we have in our General Inspectorate. They are 4 stretcher ambulances, but for the COVID patients, we use them even if it is 1 patient, because they are much larger. They allowed us to deal with the patients better and to have our team dressed in the protective equipment and so on. And then the emergency departments in the hospitals were transformed into nearly intensive care departments. These were the last line of defense. Intensive care units were full, no more places there. In our emergency departments, we have ventilators. Here, this is a short interview with the doctor in an emergency department. And you can see patients on ventilators.
Atât în zona cu pacienți infectați cu acest virus COVID, atât și la fel și în zona non-COVID, cum spunem noi.
Some of these patients were staying for hours, not only hours, for days, because of the lack in the intensive care department. But they were getting the care they needed, which means it was much better than having them in places where they couldn't get the care. So the emergency departments of the hospitals were used, as I said before, they were used to deal with normal cases coming every day, accidents, heart attacks, everything, but all of them created some areas to deal with COVID patients and ventilated areas to deal with ventilated patients, patients who needed intensive care until we found a place for them. There were days where we had around 200 patients like this in the country waiting for places to be admitted, but they were getting the proper care they needed. Then Romania went another step, and we created the stockpiles for rescue. That is the EU civil protection mechanism stockpiling. Romania was the first country in Europe to create a stockpile for rescue based on ventilators and masks. And we started distributing. Then Germany went in, they also did the same thing. And now there are several countries which are creating stockpiles and different mechanisms for the rescue in Europe. The rescue, in fact, is a system where we create stockpiling, and when there is an emergency in Europe, we deliver the stockpiles to the countries which need the support from that type of equipment. Some of them, they are lent, like the ventilators, we recover them. The masks and so on are donated. We had special missions at the beginning, and this is very important to look at the cooperation with the military. This is how we were bringing Romanian citizens at the beginning from Asia when we didn't have cases in Romania. We created systems inside the airplanes to isolate the patients from the crew. We didn't know much about the virus at that time. And you can see here the decontamination areas and so on at the area of arrival. And this was done under the European Civil Protection Mechanism and in cooperation with countries like UK, France, Germany, and so on. Here you can see other types of missions which we have done, and these are under the rescue. You can see Italy, Spain, using military airplanes, taking masks there. Here you can see also donations to Montenegro, to North Macedonia, to Lithuania, Serbia, Montenegro, Croatia, and Czech Republic. And we sent ventilators to the Czech Republic from the rescue mechanism. So solidarity became extremely important. And this is something we lacked in the first 2 months. In the first 2 months, everybody was trying to do something for their own. We even created some regulations which were weird, like no more export of materials to other countries in Europe. We keep them for ourselves and so on. But we passed over this very fast, and the cooperation started and countries started working together. Romania in 2021 until now, that is 1 year and 8 months, had 36 international missions, most of them related to COVID, including sending medical teams to Italy, to Slovakia, to the Republic of Moldova, and now we have a medical team in Tunisia, which is coming back after spending 3 weeks in Tunisia on Monday. But we also went for the earthquake in Croatia for delivering aid. We went for the fires in Greece. We had 108 firefighters for 1 week, and now we have 142 firefighters for another week. We sent fire extinguishing airplane to North Macedonia. So this shows you that during a disaster, the rest of the world is working, and disasters are coming even on other issues like fires, earthquakes, and so on. So we still need to respond to these, even if we are dealing with a long-term disaster, which is the pandemic and the SARS-CoV-2. The teams we sent, the medical teams here, you can see we used the military airplanes for this. So it was all in cooperation with our Air Force. Our law permits this. We can get an airplane like this in maximum 2 hours if we request it. The medical teams were sent using such airplanes, and part of the aid was sent using those airplanes. Then you can see this is in India. When Romania delivered aid to India, then we delivered aid to Lebanon when there was the explosion in Lebanon using these airplanes. So here you can see again the work with the logistics of the civil protection to move the materials and to transport them for donations. And here what you see, I want to stay very shortly on this film. This is a NATO airplane arriving from South Korea with protective equipment. So you can see a C-17 arriving from South Korea and we had 2 missions like this using Romanian hours and 1 mission donated by the United States Air Force for us. And then building the modular hospitals. These are modular hospitals. This is one of the military modular hospitals where we had civilian doctors working in it. We had 3 like this, which were built, including intensive care capabilities, working with the military. The vaccination, as I said, this was a different thing. This was the committee for vaccination. It is separate from dealing with the COVID effects and so on. So it is different than that. And that committee is being coordinated by the Ministry of Defense and the Ministry of Health. We are part of it. We work with them. Whilst dealing with the COVID impact, it's mainly coordinated by the Civil Protection together with the Ministry of Health as partner with us and the Ministry of Defense. These are the trucks which you have seen inside with the intensive care unit for 12 beds within. And these are other types of modules that were built near the hospitals, but these are fixed containers for intensive care. And these were built, but we never used them to house people there. For simpler cases, if it will be needed, we could keep a large number of people there, but we didn't use them. So if I go to the conclusions, I'm sorry if it was long. So the conclusions show that we achieved an integrated operational management at national level, and we had also the county levels and the local level connected to the national level. We needed the centers, the integrated centers, we needed them to work and to function together with all the resources at the same way. Of course, the decisions had to have a better mechanism to implement them and a faster mechanism, and this was improved during the last 1.5 years. The medical stockpiles become a very big issue which we need to look at, and we need to learn from here so that we don't fall in the same mistake after 2 or 3 years, and we don't forget that we cannot be completely dependent on areas which themselves may face a disaster. We need to have a different way of approach to our essential needs. We need even to allow, and this is an issue in Europe, to allow countries to give subventions for essential needs companies so that they keep on producing and not stop based on the market issues and find that everything essential is found in only 1 or 2 countries because it's cheaper to do it there. But when you need it during a disaster, you cannot access it. So we need to rethink these issues. The other issue I think we need to rethink is the way our hospitals are thought. We found huge difficulties with hospitals because they were thought like they should have maximum capacity because this means that they are productive and good. But when they are facing a disaster, the capacity is immediately overwhelmed. So instead of looking at a hospital which has a maximum capacity of 95% in order to be cost efficient and not having redundant beds and so on, we need to start looking at it differently, and we need to create redundancies in human resources, which was a very big issue, and in spaces and in equipment. And hospitals must have redundancies to deal with such situations and to face a major influx of patients in a short time. This pandemic, in my opinion, and with this I'm finishing, was, let us take it as a warning to us. The next pandemic may be much worse than this one. And it may bring an agent, a virus, which is much more aggressive and which will put us under a very hard test. So we need to draw conclusions from this pandemic to prepare for a worse than this pandemic in the future. Nobody knows when, but we need to prepare for that. Thank you very much.